Hi guys.
Hello.
Okay, we're back with all-around health talk. So we're going to continue with the STI series, and today we're going to be talking about syphilis. I'm sure a lot of you have heard of this STI and how very rampant it is in our society, and that's why we're doing it today. So, what is syphilis? Syphilis is a highly contagious, sexually transmitted infection, which means that you can mainly get it through sexual intercourse. So the name of the bacteria that causes syphilis is called Treponema pallidum. Now, we have different types of syphilis. We have the acquired syphilis and we have the congenital syphilis. The acquired syphilis can be divided into primary, secondary, and tertiary syphilis, while the congenital syphilis is the one that can be passed from mother to child. So it doesn't just affect only pregnant women, it can also affect their unborn child or children. So yeah, this is very, very, very important. Now, what are the risk factors of developing syphilis? Sexual promiscuity. In case you don't know what promiscuity means, it means when you are sleeping with a lot of people at the same time. You have like multiple sexual partners.
Plan A, plan B, plan C,
plan exactly D. That kind of thing. You have like side chick 1, side chick 2, side chick 3, or side bobo 1, 2, 3. Yeah. So like when you have multiple sexual partners, you are increasing your chances of getting syphilis. Next is when you have unprotected sex, because it's not just having multiple sexual partners and then you go and have unprotected sex where you don't use condoms or any kind of protective means. You're like increasing your risk of getting syphilis. Now, next is HIV. If you have syphilis, especially like around the primary stage, you have a high risk of getting HIV and vice versa, because if you have HIV, your immune system is also depressed and you now have high risk of getting syphilis. So they come hand in hand. Now, the next risk factor, this is mostly for the congenital syphilis. If you are an infected mother, you have a high risk of transferring this syphilis to your child, causing like really fatal consequences or disabilities for that child. So this is really, really delicate. Yeah, so those are the risk factors for syphilis.
Okay, so we want to talk about the symptoms. What should you look out for? Like she said, there are different types of syphilis. We have primary, we have secondary, and we have tertiary syphilis. And for these different types, we have the early stage, we have the latent stage, and we have the late stage of the disease. So let's talk about primary syphilis. Primary syphilis is going to appear like an ulcer. Okay, it's going to be one or more ulcers, which in medicine we call chancres. They're going to appear in the site of entrance of the bacteria. Okay, so if you had sexual intercourse, either vaginal sexual intercourse or anal or oral, based on the type of sexual means you use, this ulcer is going to be present there. So it can be present in the anus, it can be present in the penis or the foreskin, it can be present in the cervix for women, it can be present in the vagina vulva, which is like the entrance to the vagina. So it can also be present in the urethra. There are other places it can be present in that are not so common, but that will be in the mouth, your lips too, because remember that there's oral sex, so it can also be transmitted through that means. So this ulcer is painless, which is the bad thing about this disease, right? Because when something is painful, it makes you want to go and check it out. Now, this ulcer is totally painless, and you might begin to think that it's harmless, okay? But it's not. If you see any kind of ulcer on any part of your body, it is important for you to check it out. Now, this ulcer is going to appear within 2 weeks to 3 months of your exposure to the bacteria. Now, this ulcer takes between 2 to 6 weeks to heal. Now, if in this primary stage of the disease you don't go to the doctor, you're not diagnosed, it's going to advance to the secondary syphilis. Now, in this case, the bacteria is now spreading to more parts of your body. What are you going to see in this case? You're going to start having rash all over your body. The rash is painless and the rash does not itch. So again, syphilis is kind of tricky because you don't feel any discomfort. You just see rash on your body, but since it's not itching you, it's not painful, you just feel like it's nothing. So that's the problem with syphilis. It's kind of a silent killer. So you're going to have rash that could spread all over your body, or it could appear in patches. So as we said, no, it's not painful and doesn't itch. You're also going to start having flu-like symptoms. You're going to start having tiredness, loss of appetite. You're going to have growths that look like warts, mainly in your anus and in the vagina area. Now these warts most times are confused for just normal warts infection, but it's syphilis, so you also need to check that one out. Now you can also start having white patches on your tongue. You can start having white patches on your tongue or on the roof of your mouth, and then you can also have patchy loss of hair. So you can start, your hair can start falling off, but in small patches. So you start having some round circle on your head, empty, no hair there. Okay, the rash also appears frequently on the palm of your hands and the sole of your feet. So you need to watch out for all these symptoms. Now, if still presenting these symptoms, you don't go to the doctor and you don't get treated, it can advance to a tertiary stage and affect your bones, your brain, your nervous system, and your heart. In this case, there's less chance of recovery. Now, this is the primary, secondary, and tertiary stages of syphilis. But there's something, a very important stage we need to talk about, which is the latent stage. This means that basically you have syphilis, but it is sleeping. You have the bacteria in you, but it is not showing any kind of symptoms. No ulcer, no rash, no patch of hair falling off, no white stuff on your tongue, nothing. You don't have symptoms. You look like you are normal. You look like everything is perfect, but you have the bacteria inside you. And this is like the most dangerous part of syphilis, the most dangerous form of syphilis, because you can go from weeks, months, years with this bacteria in you without showing any signs and symptoms. And the time you begin to show signs and symptoms is because your heart, your bones, your nervous system are already being affected, and then your chances of survival are really, really low. So we need to be people who go for regular checkups. Not every time you have syphilis that shows symptoms. So if you're the kind of person that goes for regular checkups, you can get your diagnosis of syphilis even without presenting symptoms. So this is really important. Please, we need to take care of our health, because we can only achieve our dreams if we're alive. Yeah, so please, I know you're working and you're busy trying to make the money, but if you make the money and you can't even live to enjoy the money, it's like
just pointless.
So please pay attention to your health.
Thank you. So this is the first part of syphilis. The next part is going to be the diagnosis, prevention, and treatment of syphilis. So you guys stay tuned, and don't forget to like, subscribe, thumbs up, like, just drop your comments and your questions. I keep emphasizing on that. Send in your questions so that we can have time to compile everything and give you guys the best answers possible. So guys, stay safe and bye. See you next week.